My name is Stephanie. This is my daughter, Allie. This is Grandma Dolly. We are the Bellamy's. Allie has been ill since the day she was born. She had sepsis every 3 months like clockwork. She had frequent pneumonias, and we knew something was not correct. And that's what prompted a physician to do the necessary blood work to look for an immune deficiency. Allie was diagnosed with combined immune deficiency at the age of 7.
Combined immune deficiency, or CID, is a milder, to some degree, version of SCID, which is severe combined immune deficiency. Nevertheless, it can kill just as well, unfortunately. The only difference is that rather than kids dying in the first year of life, they might die 4, 5, 10 years later due to an overall lack of immune cells, typically lymphocytes, and the continuous destructive force of various infections. Ellie is probably the rarest of the rare. She was fortunate to be born with defects of her intestinal system and also her immune system.
It was overwhelming, and yet it was a relief to find out what was going on and to have some answers. The worst thing that a parent can do is get on the internet. The first thing that pops up is mortality rates, and that's a horrible thing to look at. We actually initially came here for her small bowel transplant evaluation and were sent to the rare disease clinic because she would need to have a bone marrow transplant first.
I joined Ellie's treatment when it became obvious that her weakening immune system is going to prevent a successful small bowel transplant. They asked me to see if we could do a bone marrow transplant first, provide her with an improved immunity so she could undergo subsequently the small bowel transplant.
This is the only hospital that could have saved Allie. No other physicians would have done a bone marrow transplant on Allie. They didn't have the doctors to do it. They were here.
We have successfully performed the cord blood transplant, the bone marrow transplant, some people would call it. This has already made her immune system stronger. Nevertheless, it's not a completed story until she can have her small bowel transplant, so her quality of life finally is going to be such that she could be in school and not dependent on IVs and IV nutrition.
Today, Allie has a new immune system. She has the immune system of a healthy 15-year-old. It's given her a whole new life. It's given all of us a whole new life. It's wonderful how those doctors have worked with Allie and really just helped change her life and our lives for the better.
I would love to see Allie be disconnected from all IV fluids, IV nutrition. She already has a wonderful personality, very positive, very upbeat, despite all the challenges of her life. Hopefully, sometimes over the course of this year, there will be a good match for an intestinal donor as well. And with her improving immune system, she should be hopefully then strong enough to undergo that procedure, and would love to see her participate in all the activities that other 16, 18-year-old young ladies would be doing.
The last 13 years have been very, very difficult. Coming to Children's here has been a life-changing experience for both of them. The doctors are truly amazing. The peace of mind that they've given to us and the hope and the belief is priceless.
We have a connection with the city now, and it just
makes us happy.
It does. Pittsburgh has a place in our heart. It's given us hope. It's wonderful.
Our teams of international experts are focused on treating children with rare diseases, defined by leading standards of care, pioneering protocols, and individualized services in a world-class environment. At Children's Hospital of Pittsburgh of UPMC, you are not alone.